This Good to Go segment is sponsored by Spectrum Health Medical Group.
Lots of folks admit they have been putting off some fairly routine health care during the pandemic, and that's ill-advised. But what about even more critical care? We're talking about things like preventative cancer screenings. Dr. Anas Al-Janadi is the Department Chief for Hematology and Oncology at Spectrum Health Cancer Center, and he joins us now to talk about why those screenings are important even during a pandemic. Dr. Al-Janadi, good to see you.
Thank you, Catherine.
Am I right? Have folks been putting off these cancer screenings during this pandemic?
Yes, unfortunately, we learned through the past 12 months that patients, and unfortunately, it's probably the nature of the humans, they were afraid of going to healthcare facility. And frankly, even before the pandemic, we were having hard time getting everyone do their recommended screening. So that was like, a reason for them to find why they actually want to avoid it. And it did decline. It declined during the pandemic in almost everywhere, not only in Michigan, and from my colleagues and from large national publication, almost everywhere.
Across the country. Why is it so important that we keep up with these preventative cancer screenings?
For the past few decades, we've been working hard on determining the best way to prevent or reduce death from cancer, right? So, and we have realized that many cancers are great when then there's no great cancer, I'm sorry, but there are cancers that we have great results when we discover them early. If we discover breast cancer early, if we discover lung cancer early, prostate, colon cancer, cervical cancer, those are actually easily treatable with very good results at the time when we detect them through screening. But if we wait until they have symptom, until they manifest in our body, that's probably going to affect negatively the outcome.
Are there certain screenings that are more critical than others?
I would not personally triage them this way, but I would say all of them are important. But I'm glad you asked this question. I would still think people should not put off the screening for breast cancer, lung cancer, and colon cancer and cervical. Those are prostate cancer. I'm not just being here a anti male, but at least that one actually I really don't recommend people put it off because it's a blood test anyway. It can be done in any peripheral lab. It's really a simple test.
Speaking of the guidelines for which screenings, when, there's so much confusion, and it seems like sometimes those guidelines change about certain screenings for men and at what age. Same with women. The breast cancer comes to mind because there's been so much change around that. Can you give us some examples of screenings for men or women at certain ages?
Certainly. I just wanted to make sure that I remind everyone listening to us, Catherine, that they should always consult with their doctor. We have set of guidelines are always updated. We have even our guidelines at Spectrum Health Cancer Center. And again, those are all drawn from evidence-based guidelines published by the American Cancer Society and the United States Prevention Task Force. So for instance, let's say colon cancer, I just want to give you an example. It's actually a very important screening because it has shown clearly and repeatedly over the past few decades that it decreases the chances of dying from colon cancer. So we used to say that at age of 50, start colonoscopy, but now we actually found out that this has likely, and it will change, it's just waiting for sign off from some regulatory organization. That age will be lowered, for instance, to 45. So that's the importance of, if anyone knows information in their mind and they think it's still current, they always should check in their visit with their doctor to update them on the screening. Same thing for breast cancer. We think that women at least should have the first mammogram at age of 40. And after that, the frequency of that will be discussed based on their risk. But at least from age 40 and onward, there are a regular scheduled screening for breast cancer. Just people need to take that in consideration.
And of course, as always, know your body, talk to your physician. If something feels or looks or seems funky, ask your physician. And it is easy, folks, to sign up for these cancer screenings. All you have to do is contact Spectrum Health Cancer Center. Their number, 1-855-SH-CANCER, 855-SH-CANCER. It's as easy as that. Dr. Al-Janadi, thank you so much.
Thank you very much, Catherine. My pleasure.